Okay, we are going to get started. Thank you all for being here. I'm going to provide some kind of kickoff comments, and then I'm going to do a little bit of run of show. My name is Phil Chung. I am the Senior Director of Learning and Evaluation at the Colorado Health Foundation. We are excited that you are all here today. I'm honored to make a few brief kickoff comments, and one thing I wanted to mention also, we have some folks who are joining us online. We want to thank you for joining us in person. We want to thank those of you who are joining us online. So I do want to take a little bit of liberty while I have this moment. And I will say it's great to see so many Asian AAPI, AANHI faces in the room. I don't know if you were like me as a kid or even as an adult, if you were the only Asian person in your class, or if you were the only Asian person in your organization. And so to see this many faces in one room, and I know there are so many others that are either online and that are not in this room that we all work with, we all know, we all love. And so it's spectacular to see this group of folks in the room together. So it is amazing. And so we hope you have a wonderful day today. So I'm going to start off with a bit of run of show in terms of what we're going to get into today. And so we're going to kick it off in a few moments. I'm going to introduce our president and CEO, Karen, who's going to deliver some welcome and opening remarks. Then I'm going to, Jean and Christy, who are the co-chairs of the Colorado AAPI Circle, are going to provide a little bit of history, a little context of both this project as well as the Colorado AAPI Circle. And then we're going to get into it. We're going to get into with our friends from the Colorado Health Institute who led this amazing research project, this storytelling project. And so we're going to talk a bit about some of the findings behind the Colorado Lotus Project, which is, I believe, officially launched. It is out there on the website today. So it is out into the world. And then we have some of our AAPI leaders in the community who are going to join us in a panel discussion to share their reflections and their thoughts, both on the findings and their experiences. We'll have some closing remarks. And then we do have food. And as you know, Asians love food. And so I did want to mention that, so we are being catered by Zin Zin, who's a chef from Burma. And so we have some wonderful Burmese food that hope you can join us from 11:45 to 1 for those of you who are in the room. I did also want to mention, you may have seen this on the news or on the TV or whatnot, that at 11 a.m., the city of Denver is doing an emergency warning siren just for a few minutes. And so if you hear an emergency warning or some loud noises, nothing to be alarmed by, just for a few minutes. Maybe one might take a quick bit of a pause. Is the city doing an emergency warning siren test? And so you'll hear a couple acronyms today, which you are probably all very familiar with, including AAPI, which stands for Asian American Pacific Islander, NHPI, Asian American, Native Hawaiian, and other Pacific Islander. These terms were used throughout the course.
Those of you online, can you hear us now? Yay! So welcome to the Colorado Health Foundation. I'm Karen McNeil-Miller. I have the honor and the pleasure of being CEO of this organization and shepherding our mission to create health equity through racial justice. Like Phil said, I too am so happy to see so many AANHPI faces in one space. This is a first for me. in Denver. It really is. And so I'm excited to see you here. And sometimes the stars do align. Many of you know that we have an annual symposium in Keystone, Colorado, July 27th through 29th. Registration is open. And this year, our theme is parentheses, rewriting narratives. We are surrounded by narratives that are untrue, all the kind of words you want to use, false, lies, myths, stereotypes, caricatures. And if they didn't affect us, if they didn't make any sense or didn't affect us, we could all just shrug it away. But the fact is they do affect us because decisions are being made based on those myths and falsehoods and those false narratives. Practices are being built, systems that perpetuate racism, that perpetuate discrimination, that perpetuate inequities, get reinforced with all of those narratives. And the narratives are so insidious. We swim in them in every move we make. And some of us, I would say many of us, myself included, we unknowingly have adopted and accepted some of those narratives. And we are living our lives and moving through the world in some internalized oppression. We've internalized some of those narratives. I've lately been working with a group of Black women, and one of our sessions was on the lies we tell ourselves about rest. And what narratives have we accepted? You know, you don't stop until the work is done is one of the lies that I accepted. And if you got time to lean, you got time to clean. And it was that we don't deserve rest. And that's a mild internalized lesson. But after centuries, we all have that. And so we want to work with community to how do we reframe, correct, redirect those narratives. And that is exactly what the Colorado Lotus Project wants to do as well, with the focus on the AANHPI community. They want to shine a light on those inequities and disparities and talk about how we can move past them, how we can shift and change them. And with this being AAPI month, it's a perfect time, absolutely a perfect time for the launch. So we're excited that you're here. We're excited for this research. I apologize, I am not going to be able to stay. I'm in the middle of a community college system meeting where we're hearing from all the community college presidents on their plans for if there's disruption at graduation this weekend with protests. Talk about false narratives and some of that. So again, welcome here. I know this is exciting research. I haven't seen it yet, but I can't wait to see it. So I want to turn it over now to Jean Shia and Chrissy Keolakai. I know I got it wrong. Keolakai. To keep us going. Thank you both. Thanks, everyone.
Karen and Phil, thank you so much. We are so excited to be here and grateful that the Health Foundation is hosting this event. Hi, everyone. I'm Christy.
I'm Jean.
And we are co-chairs of the Circle. Some of you may not know about the Colorado AAPI Circle. For those unfamiliar with us, we are a fund at the Denver Foundation. Giving circles welcome people of all financial capacities to come together and build collective strength. We each bring our unique lived experience, and together we decide which organizations in the community we are going to support. Last year, our only 20 members collectively provided $24,000 and grants to fund groups like Payson. Is Annie here? Annie, thank you for all that you do. And we also provided a grant to APDC, which is now called the Cultural Development and Wellness Center, and many others. That was our first year of grant making, and we're going to do it again. For those AANHPI in the audience and those on Zoom, we want you to join us. We're grateful that you're here today, but we want you on a bigger journey along with us in the circle. We have many circle members in the audience today. Can you folks raise your hand? Harry, Cindy, Gary, Francis, Sarah. Note who these people are. When we are eating lunch, find them and start a conversation. These are amazing human beings, and they are thoughtful, and they will also try to convince you to join the circle. For those of you online, reach out, let's connect. We would love to hear from you.
So in a lot of ways, our circle and the Lotus Project started in this room. About 5 years ago, we hosted an event here that included Harry from formerly the Asian Pacific Development Center, who made a very thoughtful comment about the inability to serve the community of what was then APDC because of a lack of disaggregated data. And APDC staff couldn't identify the who or the where of where they were until they were literally at his doorstep. That comment did not sit very well with a number of us, and we continued conversation about what we could possibly do about it. But for the better part of 2 years, we really didn't have any real answers in sight. Many of you know that because of a lack of disaggregated data, our cultures, traditions, and experiences get flattened into usually a single category, which is just Asian. When the pandemic hit and anti-Asian sentiment and violence increased, we all saw and felt it as well. We had grandparents who were being assaulted in the streets. Women were pushed to their death in front of subway cars, and college students were stabbed on their way to school.
Sadly, that's just a few examples. I know that I felt fearful, and I worried about my friends and relatives, my colleagues, and strangers. That said, the circle wasn't created to be a healing space, but in many ways, that's what it has turned into. Because we have had to convert that fear and that anxiety and that anger into something bigger. How we did that is we used our collective privilege to create Lotus. In this same time frame, lots of things were going on, lots of churn, but there were a couple of pivotal things happening. One is that the US Census changed how they do things. Second, Pew predicted that by 2055, AA and PI will be the largest immigrant group in the United States.
A few years ago, there was a study by the Asian Americans and Pacific Islanders in Philanthropy, or AAPI for short, that found a pretty staggering statistic about funding in philanthropy across the country. Specifically, nationwide, our communities, those who identify as AA and HPI, were being funded at only 20 cents for every $100 being invested by foundations. Let me repeat. For every $100 invested across the country by philanthropic institutions and foundations, only 20 cents were being directed to us.
We had to do something about that. When we founded the Circle, we identified a source of inspiration for Lotus. It's called We the Resilient. And this was developed and authored by Alaskan Natives and American Indians living in California. This report created benchmarks for everyday areas of life: housing, school, work. And it also shared stories of strength and is done in a motif that is representative of their many cultures. You will find many similarities to Lotus and this report, but we wanted to acknowledge and express gratitude for the creators of We the Resilient.
Karen's earlier remarks on narrative change are important. And for us, Lotus is the starting point to help end some of those false narratives. First, the model minority myth is politically constructed and created to characterize Asian Americans as successful or wealthy or intellectually superior. They say we all have tiger moms or have perfectly polite children and are academically gifted. This is a lie, and it was created to denigrate other people of color and create a division or a wedge between us. That lie also masks our communities who are most in need. Those at the top, especially those on an income scale, mask those who have real needs at the bottom. And when our communities are at the bottom, they become invisible.
Another myth is that, and this makes me giggle because all of my people in the circle are not docile and not obedient. But that is a myth that Asian Americans, that's how we're characterized. Our little tagline of making waves is an intentional nod to address that myth.
Before the fantastic CHI team shares some of our findings, we want to acknowledge and thank our funders for this work. We are incredibly grateful for their support and our challenge to keep our communities as part of the ongoing commitment to their equity journeys and decision-making. Our message to all of our friends, funders included, is keep us at the table and lift our voices in the discussion.
Our gratitude list for CHI is very long. To accomplish Lotus, we had to have partners that understand data and can authentically engage a diverse community. We had that in CHI. We can't thank everyone today, but we wanted to acknowledge the core team and say their names out loud. Karam Ahmad, Rachel Boyer, Saman Mathur, Lindsay Whittington, and the team's leader, the masterful Kimberly Fu. And Karam and Rachel.
Use this mic. Thank you, Christy. Thank you, Jean. Thank you, Colorado Health Foundation, for hosting us. We are so excited. It is AAPI Heritage Month. The timing of this report is impeccable. I actually can't believe that we were able to make this happen. Thank you all for sharing your time with us today, and to the folks online as well. Thank you. My name is Karam Ahmad. I'm a director with Colorado Health Institute. I've been at CHI for about 7 years. It'll actually be 7 years next week. And super thankful and honored to be part of the Colorado Lotus team. I'm going to pass it to Rachel to introduce herself really quick too.
Hey everyone, thanks for being here. My name is Rachel Boyer. I'm a research and policy analyst with the Colorado Health Institute. I'm very pleased to be here today. I want to shout out my mom, who is a Chinese immigrant who came here when she was 16 without her parents to pursue education and more economic opportunity. So thanks, Mom.
Thanks, Rachel. And so why does this work matter to me personally? While I don't identify as AA and HPI personally, I thought I did. Like, as weird as that sounds, I thought I did when I was younger. Growing up, so why did I think that? Both of my parents are immigrants from Iraq. Iraq is in Asia, it's in West Asia. And growing up, every time that I had to fill out a form or take the CSAP or the SAT or the ACT or whatever, there was only one box to check that kind of made sense for me, and it was the Asian box. And therein lies the exact problem that we're trying to unpack. It's not just about data disaggregation, right? It's about cultural disaggregation. It's about unpacking the hundreds and thousands of cultures and traditions and centuries of languages and lived experiences that that so many people live. So that undergirds really why we're doing this work and why this work is important. So we've got even more acknowledgements. I know we just did a few of those, but we really wanted to make sure that we acknowledged and thanked our AAPI Circle members, our advisory group members that made were thought leaders with us, and community members that really made this work possible as well. Andrew Ho, Darren Tang, June, it is so good to see you. June was my classmate in grad school. Kai, Kay, Yangmi, and then our partners that really illuminated this work and brought it to life, either through the art that made the work beautiful, or the stories that illuminated this as well. And that included Gil Asakawa, the writer. Gil, good to see you. Joanne, thank you for your work and your thought leadership on this project, and your help with some of the engagement. Joey, you are such a wealth of resources and knowledge. Thank you so much. Melavi and Nali, thank you. Melavi for your storytelling, and Nali in just a moment will share why we are super excited about your contribution to this work. And then, of course, we'd be remiss to not thank the dozens and dozens of community members and thought leaders and members of the AA and HPI communities that contributed to this work as well. So I want to pause and just put your attention on this beautiful work of art. This is the cover for the Colorado Lotus Project. And as you'll see on the cover, you will see the sort of geographic diversity in Colorado, which is meant to, and this is in the background, this is meant to represent the many communities where AA and HPI communities live in Colorado. You've got the Eastern Plains, the Western Slope, you've got the metro area. And then in the foreground, you'll see lotus flowers in the shape of hands coming out of the water. We chose the lotus flower as an image for this project because the lotus flower, it's not only sort of it's the national flower of India, it's the national flower of Vietnam. It is a culturally significant symbol of resilience in the face of challenges across AA and HPI communities. And we wanted to thank Nali Lore. She hand painted this. Like, how incredible is that? Thank you so much, Nali, for capturing such a dynamic sort of, we went to her and we were like, can you paint something that captures the entire geography and the culture and the lived experiences of people in a symbolic way? And she's like, yeah, I got you. So thank you, Nali. And in that symbolism of uplifting out of the water is really the sort of, with the lotus flower, is really that the mission of the Lotus Project. So undergirding this project is the idea of uplifting the unique voices of AA and HPI communities across Colorado with respect to many different domains. So we uncovered themes in health, in education, income and economic opportunity, housing, civic engagement, many different areas. And we really want to emphasize this notion of dismantling the perception that AA and HPI communities are a monolith. If there are three things that you remember from this presentation, the first one is exactly what I just said. So AA and HPI communities are not a monolith, and the model minority is a myth. Second, the communities have different experiences across those different domains, whether we're talking about health or we're talking about housing. Some groups are facing inequities more than others, and it's important in that data disaggregation, that cultural disaggregation, to understand those nuanced differences. And then finally, the communities, these are some of the strengths that we uncovered in our findings. Communities are resilient. They have rich histories that they share and they celebrate, and they show up for one another. There's a lot of connection in the communities across Colorado. To make this work, which is all about understanding community happen, the process had to be driven by community. So what did the process look like? We had to establish a lot of partnerships. We created a community advisory group. And we sort of phased this out into 3 stages. First, we have to sort of understand what data currently exist. Some of it's good, some of it's really not good, and there's a lot of work to do. And where there were gaps, we wanted to complement that by uplifting voices and experiences from community, by doing a lot of very thoughtful community engagement. And then the third phase was, I mean, it's all of you in this room today. It's us taking that, putting it together into a report and sharing these findings in a meaningful way. So some of our guiding questions across those 3 phases. In the first phase, for example, one of the questions was, where do AA and HPI people live in Colorado? I'll share in just a second how we address that. For uplifting voices and experiences, we really wanted to, like I said, understand what the data was not telling us, the quantitative data was not telling us, so we talked to community to understand that. And then in the third phase, we really wanted to sort of think about how can we best share these findings. And we're doing that in many, many different ways. You probably already saw that we have copies of the report, and there's so many ways that we're looking to disseminate this. So in those 3 phases, for example, with the understanding of the current data, to understand where AA and HPI communities live, we created an interactive map where those communities are living. Rachel's going to touch on a philanthropic analysis that we did to better understand how is funding currently looking in Colorado for AA and HPI communities. We've got a ton of data. And then to complement that, because you can't understand a community with just data, you have to complement that and have a harmony with the community conversations, with understanding what is actually happening in community and what are those needs. So we had conversations with community leaders and experts. We had an online platform where we engaged with folks and got a lot of insights as well. And we had these really awesome dynamic focus groups that were focused on particular AA and HPI communities. We had one for immigrants and refugees. We had one for South Asians. We had one for youth. And we wanted to make sure that we were also capturing that in the story. So Gil and Mel, thank you again for capturing some of that for us. And then we put that all together in a final report. I'll touch more on this at the end. We'll have a QR code up on the screen that'll give you access to all of our materials, but don't need to belabor this. I'm going to pass it to Rachel to talk a little bit about what we learned from the philanthropic perspective and also in some of our data.
Okay, I am so excited to get into our findings, and we're going to kick this off by having a little audience interaction. So you can go ahead and pull out your phone and use this QR code. Those online, please feel free to participate along as well. You can go to this link and type in the code. Looks like the link was just dropped into the chat. So we're going to have this interaction and then one more. So keep your phones out after this. So we heard earlier that Jean and Christy shared the statistic that in Colorado or nationwide, only 20 cents of every $100 of foundation funding goes towards the AA and HPI communities. And so we want all of you to guess what you think it is in Colorado. So we have a little poll, and you can go ahead and submit your vote for what your guess is for how Colorado compares to that national figure of 20 cents for every $100. We have the results coming in. It looks like people are taking the cynical approach of the lower number. We have some optimistic people as well. Okay, thank you everyone for participating in that. Looks like the cynics win. So let's go ahead and see what the actual number is. Okay, so in 2018, which is the year this statistic is from, 60 cents of every $100 of foundation funding in Colorado explicitly supported the AAHPI community. So it's a little bit higher, right? But still a very comparable number. And overall, if you break it down by percent, it's still less than 1%, right? So very comparable number here in Colorado. I'm going to go through a little bit more about what we found out about foundation funding in Colorado. So we can look at the data a few different ways. One of the ways we looked at it was, of the funders who exist in this space, how much is kind of each funder accounting for in the total percent of the dollars that are given. So if we look from 2011 to 2018, we see that the top funder, so the funder that donated the most money, actually accounted for 86% of total funding in general. So we can see it's very highly concentrated. If we look at the top 5, that becomes 95% or 94%. And then top 10 is about 97. And then we have all of them. So what we can see from the data that we have, it seems that there is a small handful of donors in this space and overall kind of low funding levels in general. Another interesting thing that we found is that we were looking at the dollars that are supporting Colorado communities. We weren't just looking at Colorado foundations, we were looking nationwide. And we found that about 92% of the funding for Colorado's AA and HPI communities actually comes from foundations outside of the state. Another way we can look at the data is where is this funding actually ending up in our state, right? And so one thing I want to point out here is that understanding the philanthropic landscape is very difficult, and there's a lot of challenges with trying to kind of track investments in data, just various ways through that philanthropic funding flows and just kind of the reporting mechanisms. So this data isn't perfect. We only have like about 50% of the total grant dollars that are actually captured in a specific location. But from what we can see, if we look at Colorado cities, we can see that most of the funding is going to Denver, followed by Aurora, Littleton, Colorado Springs, and Greenwood Village. And all other cities in Colorado account for only less than 1% of the total funding dollars. So from our analysis, which you can read even more about, there's even more information in our report materials, we really saw that there is a stronger need for consistent philanthropic support for the AA and HPI community. And this is something that is not only reflected in the data, but is also something we very much heard from community members. So I'll put up a quote from someone on our Thought Exchange platform. I'll give you a second to read it, and then I'll read it out loud. So this participant was saying that we have a lack of a significant funder in our community. The lack of significant funding makes it hard for AA and HPI community organizations to grow and increase their sophistication. So this is, one of our primary findings from this report is that it's difficult to understand the philanthropic landscape. However, it seems like there isn't sufficient and consistent support for the community. And I'm going to go ahead and share kind of other aspects of the report. We were talking about, different areas like health and housing. And so I want to show you some of our other results from that. And really, as Cara mentioned, the whole point of this is to uplift community voices and experiences and really show the variation in our community. So before we get into that, actually, I want to do the second poll that we have for you all. So go ahead and pull out your phones again. It's kind of the same website, so it'll refresh in just a second if you have it pulled up. But online participants, please feel free to join in as well. And so this time we're gonna create like a word cloud, and we're gonna see among the group that we have here and online, how many AA and HPI communities we can name. So if you're thinking about, maybe a group you belong to, maybe a group you know or heard about, let's try to get as many identities as we can in just a couple minutes. Yeah, you guys are killing it. You guys are fast typers. This is awesome. Okay, thank you all for indulging me in that exercise. As you can see, there are a lot of words on the screen and it's continuing to grow.
We're gonna have to save that. Put that.
Okay, so as our little exercise showed, and as we know, there are many, many different communities contained in the AAPI umbrella, right? Depending on, how you define things, there are over 50 different ethnic groups, more than 100 different languages, and over 75 countries of origin represented, including, countries across East, Southeast, South Asia, as well as the Pacific Islands of Melanesia, Micronesia, and Polynesia. And this, richness and diversity of the community is represented here in Colorado. And so we just wanted to share a few pictures quickly that are taken of people across the state. We have up in the center picture a lion dance team preparing for the Lunar New Year celebration. We also have in the corner a cute little kid celebrating the Mid-Autumn Festival, just because kind of a snapshot and really to deeply underscore the fact that there are so many people here in our state and there are so many identities here in our state that they are from. So let's kind of get into some of the information in the report. And so here is a quote on a key issue, which is housing. And so I'll show a little bit of an example from our housing results and then from one more. So this person is from our recent immigrant and refugee focus group. And they said, I have a job, but everything is more expensive after the pandemic. Housing, food, but your pay is not enough. Food costs doubled, but your salary doesn't double. Housing is the most expensive. So let me show you some data that we put together. So this is a key statistic in the housing realm and is something that decision makers will commonly use to kind of assess need. And this is the percent of people who are experiencing housing cost burden. And housing cost burden simply means that you're spending more than 30% of your total earnings on any kind of housing costs. And so this is a bar chart that you might typically see in a racial and ethnic breakdown. So we have our Colorado total statistic, which is at about 28%. We also have the Asian statistic, and we have the Native Hawaiian and other Pacific Islander statistic. And you can see that even among these three bars, there's some variation. But as we just talked about, there's so many communities contained in these umbrella terms. So let's look at what it looks like in our report. So there it is. So there's actually so much information on this graph. I bet you are having like a really hard time seeing it right now. So we now have the three bars that we had at the top there, and we have more specific communities on the side. So for example, we have Samoan, Laotian, Chinese, Hmong, Chamorro, Vietnamese, just to name a few. And something I really want to underscore here is just the range in statistics that we're seeing here, right? If we're looking at the top three bars, they're clustered roughly around 28 to 32%. But if we disaggregate the data, meaning breaking it down into smaller pieces, more specific pieces, we can see that the range is much wider now, from 10 to 57%. And among the communities that are at the top of the graph, some of them are experiencing housing cost burden that's actually twice that of, the Asian statistic or the Colorado average. And so this really just goes to demonstrate how much more information you can gain by breaking apart these larger umbrella groups and kind of ultimately breaking apart the monolithic thinking that we tend to fall into sometimes. Here's another domain that we covered, which is health. This is a quote from someone in our Southeast Asian identifying focus group. They said, mental health isn't something Asian households really talk about very much. Being first generation, my family had different experiences and traumas. Mental health is something I've struggled with my entire life. I didn't even know what anxiety was until college. I always thought I was weird because I felt that way. So here's some health data, again, in kind of the way you might typically see it in a racial ethnic breakdown. This time we've got a couple statistics on the graph. On the top bars all represent the percent of people experiencing fair or poor general health. And then the bottom bars represent people experiencing mental health distress. So we have both general health and mental health on this graph. We can look at it how we've represented it in this report. And now we can see we have a little bit more information. So now we have several kind of more specific racial and ethnic groups below. And again, we can see a lot of variation, right? Suddenly there's certain bars that are sticking way out past, the state average or the Asian average. And something that we wanted to call out in this slide too is that even though this data is disaggregated to a degree, we wish we could do more with this, right? We don't actually have Native Hawaiian and other Pacific Islander disaggregation for this metric. And it really just goes to speak to the need for our systems across all domains to really be collecting this information and really be focusing on trying to be as specific to serve communities as best as possible. Okay, so thank you very much for looking over those results with me. I'm going to pass it back over to Karam to talk about how we thought about capturing strengths in our report.
Thanks, Rachel. So one of those 3 takeaways that I had up on the screen was about the strengths, and what we discovered in our process, and this was through some of our community engagement. This was through, that's Rachel's sister. Shout out Reagan. Hi, Reagan. Love the support. That's actually one of the strengths. It is I kid you not, is the 3rd strength, showing up for others and family. So great segue. We planned that. The first strength that was really a through line in our project was, despite the sort of historical inequities and the challenges that many ANHPI communities are facing, they are resilient and they are collaborative. One quote that came up from our Southeast Asian identifying focus group was, "We have a strong community that still works together despite our differences. We're only growing stronger and making ourselves known." The second theme that kind of came up through our discussions and our conversations was, there's a lot of culture to celebrate. There's a lot of culture to honor and celebrate, and folks in the ANHPI community love to share that. A quotation from a thought exchange participant, this was our online platform, said, "Being an Asian American, I am able to teach and educate other individuals about my culture. I am able to share and express some of my cultural values. This is important because there's a lack of Asian representation where they live, especially for South Asian culture. It is rewarding to be able to share." And AAPI Heritage Month is a great opportunity to do that. Support your local AAPI and NHPI businesses. And then the third one is really about showing up for one another. It's about familial connection. It's about community connection. That's why I brought in Reagan on that. But a quotation from our Native Hawaiian and other Pacific Islander focus group was, "If you rally us together, we're loud and boisterous in our numbers. Once you see someone who actually represents you, we're coming. Culturally, we all have that in common. Ohana, we come together." So this is just a couple snippets that represent some of the strengths that we have in the report, and we invite you to dive a little deeper into that in our report. And then to do that, we have some really beautifully put together stories. Again, thank you to Gil Asakawa and to Melavi Melvin for capturing some of these stories. One of them, for example, it really spotlights Denver's forgotten Chinatown. Show of hands, how many people knew that there was actually a Chinatown downtown, lower downtown, before this happened? Yeah, exactly. And the artwork actually in the historic Chinatown was done by Nali Lore as well. So shout out, amazing art. So there, Gil captured a story about sort of what happened. It was about 150 years ago, how Chinatown was destroyed, and then sort of where things have sort of reconciled in the last few years in representing that community. And then there are other stories. There's one that's centered on the experiences of Pacific Islanders in Colorado and navigating the challenges in the healthcare system in Colorado. So that just gives you an idea of 2 of the 5 stories, but we invite you to read these stories. This project is all about people. The data is really cool. The data is about the people, but this is really our way of sharing and telling those stories. And how you can get involved. So if you got your phone, you can scan that QR code. It will give you access. The project is live. We've launched today. The final report will be up on there. We've got fact sheets and that have sort of the key findings across those 7 domains. We shared across, I think, 2 or 3 of them today, health and housing and a couple other areas, but there's fact sheets with key findings across those different domains. We've got a 2-page flyer, which we would love if you all would share with your communities. We have these flyers in many different languages too. So we've translated them into 7 different languages, some of which are the more commonly spoken AA and HPI languages in Colorado. And some of them are we thoughtfully chose because they are communities that are often overlooked. So we've got a couple copies of those in the back. Kimberly, if you could raise your hand, people will know where to grab some of those. And then we've got some really, really rich data that we invite you to play around with. Reach out to the team at CHI if you have any questions or you have any inquiries about the data. And we're super excited to share this with you all. And to round out this discussion, we always finish our presentations reminding you of the 3 takeaways. So as a reminder, AA and HPI communities are not a monolith, as evidenced by everything we shared with you today. And the model minority is a myth. The communities are experiencing inequities in different ways, but also have many strengths across different cultures. And those include being resilient, having rich histories and cultures to celebrate, and showing up for one another, just like you all showed up today for us. I'm going to pass it to Jean. We're going to have a panel discussion in just a moment. And I think we might need just like a second to set up. So I'll invite our panelists to come up to the front of the room. And thank you all again for being attentive, being interactive. It was fun to do the online mentee with you all. We'll be sure to share that because I think that's a really cool graphic. All right. Well, thank you all.
Hi, everyone. It's Gene again. I am delighted to moderate this panel. Let's get started by having you all introduce yourselves, please.
Well, hi, everyone. My name is Kai Vong. I am a junior at Western Colorado University, where I serve as the president of the Asian Pacific Islander Club there. I'm also the secretary for the nonprofit Colorado Asian Pacific United.
Hello. Hi, folks. My name is Joey. I wear a variety of hats in the community. I work with Kapu as well, but the hat I'm wearing today is for CORE, and we helped facilitate some of these discussions and also look through the report and provide some recommendations. So, hello.
And my name's Harry Budisidartha. I am the former Executive Director of Asian Pacific Development Center. Since the integration with Aurora Mental Health and Recovery, I'm now the in-house counsel and compliance officer.
Hi, everyone. My name's Simon Mather. I'm a director at the Colorado Health Institute. I also had an opportunity to serve on the project team of this work. So I worked very closely with our advisory group and also had the opportunity to co-facilitate a number of focus groups with Joey. I also grew up in the Colorado area and went to high school here. And this has just been a really cool opportunity to see this through.
Thank you, everyone. Okay, let's dive in. Could you please share a reflection of this work, specifically any appreciations about the process that it took to create this report, and frankly, anything that may have surprised you?
I'm happy to start as a member of the project team. And we asked Kai to be on this panel like an hour ago. So shout out to Kai. We'll give him a minute to collect his thoughts. But like I said, I work with CHI, and in my work there, we do all sorts of research work. I personally facilitate a lot of discussions and focus groups. And this project for me was just so unique and so empowering. It was the first time that I have really been in a focus group and as a facilitator, and also truly identified with the conversation that was being had. I think something that was really powerful was the ability for all the members of our project team to really think about how our identities connected with this work. As an organization that's very focused on research and data and integrity, I think we are all learning how we sort of bring components of our identity, whether it's racial or ethnic or otherwise, into this. And this was just such like a beautiful output of those considerations. At one point I had called my 95-year-old grandfather, my Nana, to spot check the Urdu translation of a flyer. And he lives in Toronto, Canada, and was sort of like, why are you doing this work here in Colorado? Oh yeah, here it is. Thank you, Bridge Mather. Really appreciate the spot check here. And, it gave me an opportunity to share why we were doing this work in Colorado and just how meaningful and impactful it was. I think another example is one of our other colleagues who's not here today, Emily Leung, who wasn't really a member of the project team formally, but she was so passionate about the work and also really wanted to bring her identity to this. And so she helped us with our youth focus group and led the team in doing like a craft activity in a focus group. So even just from like a research perspective, I think through this project, we learned new ways to do that really honor not only ourselves as both project team members and members of the community, but also the community at large.
I think what I will add is just, it's a mix of gratitude, but also disbelief that this is actually happening. I started working at APDC in 2015. And right away, it became apparent just the lack of data, right? Like our staff would be telling us stories about, hey, we're hearing reports of increased suicide rates among the refugee communities. But then you go to like CDPHE or any of the public health agencies and ask for data, and it's like cricket. Like, well, here's the Asian number. So do you have it broken down by nationality, by ethnicities? No, nothing like that. So to see something like this happening and to confirm a lot of the anecdotal evidence that we have heard from staff is really gratifying. And that's what I'm truly grateful for all of this.
Yeah, I'd have to agree with Harry. I actually worked for the decennial census a few years ago, and it was very clear the gaps in data that existed on the federal level. And anecdotally, we were hearing locally all these stories about mental wellness, about like housing burden and all of these things, but it wasn't reflected in the data. And to actually have that broken out in this report is something that is really exciting, because now we can go to funders and say, hey, actually, you can see that a big portion of this particular community needs more support. And now we can finally have numbers with it.
Yeah, kind of like everyone mentioned, I think the biggest thing that was surprising for me was, it's 2024, 2023, and data is a big part of our lives and our decision making. Yet the way that we collect data is lacking, to say the least. And so in an academic setting, we use stats all the time, but if our stats aren't really helpful, then how do we make good decisions for the community? So like everyone kind of said, I'm really glad that this project came to fruition and we have a in-depth analysis that hasn't really been done before. And so, yeah.
Thank you all. Harry, you just shared a really amazing story about the need for disaggregated data. I have a question for really everyone, but built off of Harry's comments. The need for that disaggregated data, what do you feel like has been a personal barrier in something that you've seen in your lives where having had that data would have been a better way to more accurately represent yourself or your communities? Basically, can you share an experience of a barrier or a way in which it could be better in the future?
I can jump in here. So at Western, we have a very small Asian API population, student population. And so over the last summer, I had an internship with the newly founded Office of Inclusivity. And it was a lot of great work that we were doing. And I was tasked with kind of working towards data disaggregation in the school setting. I came to find that Asians and other API populations are actually not counted in the student report. We are classified in the white category, which is crazy. I thought, Western is fairly innovative, fairly progressive, and, they had an Office of Inclusivity. And so I would expect that we would at least have our own, as large of a category it is, at least an Asian category. We didn't. And so that was extremely upsetting to hear because, yes, there's a small amount of us, but we are still there. We're still present. And so using that, trying to find reasons on why they were doing it, they didn't really have any justifications. And so we were trying to work on it. And I think you can use those stats to prove right now our Asian Student Club, APIC, is what I run, and we don't get a lot of funding for the school. And so the reason why is like, well, technically there's 0 of you guys. And so, so obviously, that is very problematic. And so, we can use these numbers to show, hey, we're actually supporting not only the general community, but we're specifically helping out 20 API students or 35, whatever that number is. We could easily use that number to kind of appeal to student government for more funds, and to do more events and more opportunities for students to connect with culture, histories, and just each other.
Yeah, thanks for sharing, Kai. I am sorry. Those are my words for you. I guess I have more of a personal anecdote to share then. So I've recently been diagnosed with ADHD. And with the sort of lack of quantitative data and this idea of the monolithic model minority, I actually had a lot of trouble getting my diagnosis. The first psychiatrist that I went to after speaking to him had said, well, you're very high achieving. So there's something, no, I cannot give you this diagnosis. And I was very surprised. I was like, well, yeah, I've done some things in my life, but it doesn't mean they weren't hard to do. And so I think just even having data to show that there are differences within these communities and that sort of challenges the model minority myth can be helpful in the long term.
Oh, sure. Although we'll save yours for last. I mean, I guess the example I have is also in the health field. I recently have been thinking about there's a statistic for, I think, risk of heart disease and other sort of metabolic conditions. And if you look at it for Asian as a whole, it's pretty on par with what you would expect to see in the general population. But there actually is an escalated risk for South Asians that sort of gets flatlined when you, again, don't disaggregate this data. And I was talking to my own doctor about this, right? Because it's a part of, I have a family history and things like that. And she was frankly not totally aware that that was an elevated risk factor, but, was very committed to looking into it and things like that. But this goes beyond just the clinical setting, right? It's something that's really crucial in those individual appointments. But, also, so one of the things we heard so much about was how the food environment in the US, especially for immigrant communities who are moving here and are trying to make healthy decisions just doesn't quite match with their needs. And I also, I always think of the story that my grandparents also told me about when they moved to the US and they were strict vegetarians and they ordered French fries all the time because that was the only thing that they could eat. No one has had the heart to tell them that they probably weren't vegetarian French fries. But it just is indicative of the fact that there is, both a clinical mismatch as well as a cultural mismatch in some of these really key and poignant pieces of our health.
Yeah, I mean, one example where this aggregated data would be really helpful for us is that, so we work in the zip code 80010, which is basically west side of Aurora, east side of Denver, original Aurora. It has one of the highest cancer mortality rates in the entire state. And that zip code is where a lot of immigrants and refugees are settled because due to low rent and affordable housing. But with the lack of data, we are unable to determine what is the cause of this mortality. Is it cancer affecting communities that are chewing betel nuts? Is it cancer because of poor living condition due to slumlords? Is it exposure to hazardous working conditions at the meatpacking plant in Greeley, where a lot of the immigrants and refugees live? So this is the kind of data that I hope that as we become more sophisticated and more resource, we can actually target some of this underlying cause of health. Because, just a generic outreach of like, hey, cancer is bad. It's not really going to be much helpful if you don't know what kind of cancer and which communities is it being impacted by.
Thank you all for sharing some of those personal perspectives. I'm going to transition to a question about funding. Some of you have already mentioned it. It's no secret that part of this report is aimed and geared toward increasing funding for our communities. There's also a consideration that needs to be made for the sort of best practices and also safety considerations when we want to look at our communities through a disaggregated data lens. Can you share some of your thoughts on what best practices or safety considerations might be?
I'm happy to start with a conversation that we had at CHI. Actually, when we came to present to the Health Foundation affinity group earlier in the year, we shared an example of the demographic maps that we had put together that sort of show where AA and HPI communities are clustered within the state of Colorado, which is really helpful information to have if you're trying to target services and interventions and does pose a safety concern. So we had a number of conversations internally about how we balance transparency and accessibility of this data with those considerations. So we sort of landed on a bit of a compromise. So you'll see now if you try to access those maps on the CHI website, you're just asked to complete a very short, quick form that basically explains to us, has you briefly write how you're planning to use them, and then we'll grant you access. But it is a challenge, and that was just one example of how we make sure that we're balancing those priorities correctly.
Some of the best practice for funding, and this is me talking as a nonprofit person, is that now that we have better idea regarding the health outcomes of different communities, it would be more, the best practice is that for funders to actually support organizations that are from that particular community, as opposed to just, well, you're an Asian organization, so we're going to give you this funding and we need you to reach the Chamorro community. That's not really best practice. Rather, build relationship with the people from the Chamorro community and help support organizations already existing in those community. And I think a lot of funders are hesitant because a lot of those organizations are small. They may not even have a 501c3. They don't have any paid staff, but it's important for us to build that ground base so that you directly support that community.
Okay, we've had some takeaways from the report, but from your personal perspectives, what is your takeaway from this work?
I'll jump in. I think the biggest takeaway is to always involve the community that you're trying to help and target. Unfortunately, with previous reports or just previous initiatives, a lot of times it's just a 3-person team, maybe just 1 person deciding what the best plan is. But ultimately, as we all know, or I hope we all know, the communities that are being served and are going to be helped are going to know what they need. And so this project has hopefully extremely highlighted that the communities know best about where their situation is at. And from there, and the data that we collect through great data practices, we can kind of identify solutions to these problems that we're identifying.
Yeah, I think a takeaway I'd like funders to actually get from the report is to really understand the diversity within our communities, and to understand all of the different issues and struggles within them, and also to do that extra work to really learn about these different cultures. At this point in time, I don't think it's enough for you to post a Lunar New Year social media post, and that's sort of all that you do. At this point in time, I think funders really need to be digging into this community. I'm still learning, right? I'm still learning a lot, and there are a lot of different challenges and struggles that are very unique, right? Wondering if, funders, when you even talk about Native Hawaiian and Pacific Islanders, if you know the difference between the struggles between like the Kanaka Maoli, the indigenous people in Hawaii versus people in Guam and American Samoa, which are in essence still colonies of the United States, right? Do funders know this information? And are you asking the community to educate you, or can you do it yourself?
My takeaway is that screaming into the void eventually works. A lot of great leaders have raised this point well, back in the 90s about the need for data. Change does take time, but I'm glad that this is a change that's happening because it is one that the community recognize, the community fundraise, and the community did it with the support of everybody in this room, obviously, but it does work.
Yeah, I'll have to second all those. And I think another opportunity from this too is to think about how this process could be generalizable to other communities. I've spoken to friends who are part of other cultural and ethnic groups outside of Asia who experience similar challenges when it comes to data and data disaggregation. And so I hope that in some ways this can be looked at as a starting point for other studies of this type that include all of the wonderful components that everyone just raised as well.
From a personal perspective, I'm not a panelist, but I'm going to share my story anyways, which is the importance of the narrative and storytelling in this report extends beyond this report too. We all have friends from within this community who have plenty of stories and narratives that they are happy to share with you. So seek those out even beyond the amazing stories that we have in this Colorado Lotus Project. Please join me in thanking our panelists, Kai, Joey, Perry, and Suman. I'm standing between the formal end of this and really amazing sort of lunch, which is never a great thing. But once again, thank you to the CHI study team and to the panelists that we just had today. The AAPI Circle could not have done this alone, and we are eternally grateful to the members that we have, our numerous partners and allies, and the collaborators for being able to, for us being able to be here and stand in front of you and share all of this with you today. When I think about this project and about the lotus flower, I see it as a significant and major step, but only a first step. It's the first blossom of the flower, if you will. Now, the onus is on all of us to cultivate it and ensure that it spreads into the garden we all know that it can thrive within. Because there have been some findings uncovered today that you may have already known or you've experienced them for yourself. There may also have been some findings today that have surprised you or made you feel uncomfortable, maybe even saddened you. Frankly, that's the point. By highlighting these distinct community needs, we are challenging everyone, ourselves included, to make Colorado the best possible place for anyone from any walk of life. There are few denominators amongst us, even with many of us in the room identifying as Asian. What we can all agree on is that we call Colorado home. What can you do to help us now that we've released this? You can help bring this information to your community, your elected leaders at every single level of government, your friends, and your family. This report and the amazing resources are now on the CHI website, including translated flyers, and we hope you use and share them widely because, of course, the last thing we want is for this to be a one-time thing collecting dust on a shelf. But I also want to add that this report needs voice where it matters most. This report needs someone to stand up for it and to carry it forward. Someone who will make sure that our state and local partners develop civic engagement pathways for their AA and HPI communities. This report needs someone who will help hold public partners accountable when it comes to the distinct domains that we have studied today, such as health, justice, housing, and educational barriers that have been highlighted. This report also needs someone who will ensure that our partners and allies are as inclusive as possible when it comes to the racial equity for our AA and HPI diaspora. A sincere thank you for being here with us today. I am so glad that you are here, and I cannot wait to see what we can all do together in the future. Thank you. And I wanted to turn it back over to Phil for some housekeeping.